Well, that time of the year is almost here. Just next Tuesday, it will be back to school for many kids in the area.
It is a key transition for not only children, but also their parents. And joining us this morning is Dean Health System Pediatrician Dr. Tom Murwin. Thanks for joining us this morning.
You're welcome.
All right, so schools and really lots of people have been keeping a close eye on the swine flu,
Yes.
you know, predicting what's going to happen this fall. What's your take on the H1N1 vaccinations?
Well, we still want people to get the regular seasonal flu vaccine. The H1N1 vaccine should come out in late October, and it's really geared towards kids. The recommendations are geared towards kids and pregnant women because those are the ones we're finding have a higher complication rate than maybe older adults and the elderly.
I noticed a lot of hand sanitizer on classroom lists this year.
Yes, there's a lot of hand sanitizer out there, not only on the kids to bring, but at the schools they use it a lot. Because we know that de-germing their hands is really key in keeping not only influenza virus, but many other infections from spreading.
And as we get all the kids back in the classroom, are there other health concerns or challenges that families face, especially at this time of the year, that maybe don't come up other times of the year?
Well, this is when the respiratory viruses really start to come around because you get all these kids in the classroom that makes transmitting it very easy. So you want to practice good, what we call respiratory hygiene, where you cover your cough, and you wash your hands, and you stay away from people who are coughing.
Okay, so now we've got less than a week until the kids go back. And it's probably going to be tough for some to make that transition from summer, from not having a whole lot of responsibility, late bedtimes, to trying to get back into some sort of routine. What advice do you have for parents to try to get their kids into some sort of regular routine without just going cold turkey?
Routines are very good, although they're very hard to implement. So some parents are forced to by waiting too long to go to a cold turkey. But you try to get them to bed 15 minutes earlier every 2 to 3 nights so that you're switching their clock slowly. If you can't do that, then you're back to the cold turkey schedule.
Because you go from that 10 o'clock bedtime, you're letting your 10-year-old stay up to and say, no, it's 8 o'clock, you must fall asleep now.
They're not going to fall asleep. So you have to reset it over a longer period of time than a day or two if you can.
Okay, well, I guess I started late. better
Oops.
As do most people.
So there are some parents here in this room that are going to be sending their kids to the to school for the first time next Tuesday, and it's not unusual to be jittery about something like that. So what advice do you have for parents to just not break down in front of their child as they're getting on the school bus or going into the school to show, okay, it's all right, but it's a rite of passage, really.
Yes, it is, and it's very important for the parents to try to keep their emotions in check because the kids really feed off of that. It's very good to do practice runs when you're out buying the supplies. If you're haven't bought the supplies yet, you can talk about what the supplies are for and how they're going to be used or maybe where they're going to be put. Going to the school helps to do practice runs. And just like athletes think about what their game plan is going to be, you can talk to your child about what's going to happen during the day. Where is their coat going to go? Where are they going to eat? What are they going to do if they get overwhelmed and they don't know what to do? Who do they ask? So going through examples like that can really help children, especially younger children, think about what they're going to do.
I know that Hattie mentioned, I know she has a daughter who's going out to school, and she said she's a little nervous right now when she thinks about it and stuff.
And I think the other thing is to really talk to the children and try to find out what they're really nervous about, because what we think they're nervous about may not be what they're nervous about. And most parents can do a very good job of talking to their children if they don't jump to conclusions too early and find out what is it what the other kids are saying that they're worried about? Is it where they're going to put their lunch? Is it where they're going to go to the bathroom? I mean, there's a lot of things that we may look at as minor that the kids, obviously, if they have never been there before, have no idea what to expect.
All right, so have a plan.
Have a plan and talk to your children.
All right.
All right.
Thank you, Dr. Murwin.
You're welcome.